Hello, everyone. My name is Amber Huesca. I'm a student researcher at the HELIOS lab, where we're interested in the impact of Promotora's culturally tailored educational approach on cancer screenings among Latinas. I'd like you to envision yourself cooking dinner after work, when suddenly your phone rings. Your mom's number appears on the screen. Usually, she calls to remind you about family gatherings planned for the weekend, but this time, there's no excitement on the other end of the phone. Instead, a deep breath is heard, and your mom hesitantly expresses that she's ready to address the lump in her left breast, but she needs assistance scheduling an appointment. Unfortunately, the health visit was too late, since the doctor had diagnosed her with stage 3 breast cancer. This is the story of Rosa, but it's also the story of thousands of Latinas who delay or avoid cancer screenings, not because they don't care, but because they feel shame, fear, cultural discomfort, or they may encounter other structural barriers such as low level of education, transportation issues, financial concerns, and language differences with healthcare staff. We don't have a cure for breast cancer or cervical cancer, but we do have screening tools that can detect these cancers early. However, these early detection tools don't reach every woman, especially Latinas who are less likely to get screened and are therefore more likely to be diagnosed with a late stage of cancer. Inspired by real cases where late stage diagnosis could have been prevented through earlier outreach, the study examines how promotoras bridge the gap by delivering culturally sensitive health education compared to standard care. Based on information provided from an FQHC in Santa Ana and a promotora-led interventions to measure Latinas' increase in cancer screening knowledge and confidence to discuss cancer screening topics, we're working on developing a recall-based approach to determine what information Latinas retain after an intervention, rather than completing a pre and a post questionnaire, because navigating questionnaires can be difficult for patients with low health literacy. This research matters because Latinas at schools and in their homes aren't learning about preventative tools that are eligible to use. Today, where can Latinas learn about cancer screening processes, their importance, and when to complete them, when they may face barriers to attend 15-minute conversations with providers, or when 15 minutes may not be enough to address their concerns? Embarrassment, fear, language, and educational barriers should also not be reasons why Latina women delay completing a cancer screening, which is why it's important to help patients navigate the healthcare system. Early detection saves lives, and increasing Latina knowledge on why screenings are important, where to complete them, at what age, and what to expect can empower them to take action and improve their health outcomes. So the next time the phone rings in a household like Rosa's, the story won't begin with fear. It'll begin with hope. Thank you for listening.